He's an adjunct researcher with the University of Bern, Switzerland, and a lecturer of physical therapy at the Cairo University. He is a representative of the AHP in the European Society of Cardiology and the editor of many rehabilitation journals and past visiting researcher at the University of Stirling, UK. Hady, off to you.
Thank you, Glenn. Thank you very much. It's really nice to be with you today. Such an honor. I'm really happy to be with you, and I'm very looking forward to see you all in person, maybe. Okay, so I'm gonna share my screen. Can you see my slides right now?
Yes, I can see your slides now.
Okay. So yeah, so I'm gonna speak today about sudden cardiac death, the prevention protocols available from the European Society of Cardiology, and the rehabilitation notes. So I don't have any conflict of interest to declare. So I'm gonna speak about the significance of the cardiac rehab for athletes, and this is not usually a thing that most of the people are maybe dealing with. What's the component of the cardiac rehab for this population? Who conducts cardiac rehab? And the utilization of the cardiac rehab services in the UK, and the clinical notes on the evaluation methods. So let's start. So generally, who is targeted among these athletes? Maybe some people among them did like post-cardiac surgeries, like the CABG, or have any chronic cardiac illness, or even athletes without any cardiac, apparent complaint. So we have a lot to share here. So that was one of the feedbacks. One of my patients was writing that I was very happy with the cardiac rehab program. I cannot imagine someone not going through the program following cardiac. Cardiologists described it as very optional, and this might be the mistake here. But not going to cardiac rehab would have been a big mistake. So yeah, athletes may really need cardiac rehab in most of the time. They might have problems with their hearts, problem with maybe vascular disease that might again affect the cardiac disease. So why and how? We have to know the know-how of doing a cardiac rehab for already a well-trained person like the athlete. So as athletes, we provide advanced real-world and virtual-world cardiac rehab for patients with any form of heart disease, either, as I mentioned before, after any surgery. So this is like direct thing, or anyone who is having chronic illness, heart attack, heart failure, chest pain, coronary artery disease, PAD, peripheral arterial disease, cardiomyopathy, and this is most of the time is presented with these athletes as a silent cardiac illness. So at that moment, we have to realize what are the things that might suggest this illness. So how that is provided? That provided by, first of all, the medical evaluation. We have to listen to our patients and know whether they have any history for that. Any history maybe of something like palpitation might be suggestive of cardiac illness. To do spirometry assessments, basic spirometry assessments, and resting ECG. Sometimes we are need to do stress ECG. The physical activities provided for these people in the cardiac rehab program are in the form of typical aerobics, resistance training, circuit work training, interval training. So it's nothing different away from the typical cardiac rehab presented to the cardiac population. The lifestyle modification is again about the typical things: well-balanced diet, quitting smoking, regular physical activities. And here, the support and counseling is really, really important part, because this is part which is dramatically affect the cardiac event within the athlete population. It's about the social network and the individual counseling. This is really, really important. We have a dedicated section for that in the UK, dedicated for the psychological support for our athletes. So who provide that? The cardiologist for sure, physiotherapist, the cardiac physiologist, and the nurse. The part of the physical activity description may be to be like a conjoint work between the physiotherapist and the exercise physiologist. The lifestyle modification may be the nutritionist, dietitian, social worker, and the support is probably about the psychologist. In sometimes we have a need for a psychiatrist in extreme cases, but usually we depend in that on the community psychiatric nurse. So what's the rate of the cardiac rehab for already a well-trained person? So it's to limit the adverse physiologic effect of cardiac illness. As I mean, to decrease the blood pressure, increase the HDL. It does not have any effect on the LDL and total cholesterol. It definitely improved the functional capacity, even if the patient is already well trained, because as you know, this is like an individualized exercise program. So it's designed according to each single case, and definitely enhance the psychosocial and the vocational status. And the most important part of that is that it decreases the risk of sudden death or reinfarction. So we have here to pinpoint that the athletes have a definite risk of sudden cardiac death. Okay, so at the level of the genetic part, it was proved that the cardiac rehab, especially the cardiac rehab, which is targeting the high levels of activity, has an effect on gene transcription and lead to aerobic adaptation, neural adaptations, even if the patient or the athlete person is very, very well trained. So it does have an effect on the genetic transcription. We can remember some of the, he's a football player, if you remember that. He was an Italian guy. He was called David Astor. He died at the age of 31 years. That was a sudden cardiac death. So there is already a risk for sudden cardiac death. That's and this table is showing the difference between the males and females in this risk. And as clear here, it's higher in females. It might be in black people, but it's again higher in the white people. The highest possible risk among all the sports is among the basketball players. So it's really high among the basketball players and soccer players. But a lot of literature, especially from the US, is talking about the very high risk among the basketball players. So as you know, this is not like a new topic. Most of the people all over the world are talking about that, and there's a lot of the strategies that's already in place, maybe in US, in Africa, Australia, many places already have like a definite strategy for that. But for Europe, especially in UK, we have identified the risk of the sudden cardiac death and its prevalence in the UK in a recent cohort to be about 0.38%. So it's quite like a big number. So if it's calculated among the population, it will be like 225.3 per year. So I would say that this is really a big number. So sudden death is not really rare, but are preventable? I would say yeah, because there is a lot of literature which is published by the AHA, ESC, and ACC, many societies talked about that and identified like a definite strategy that we have to follow as a prevention tool. So our prevention process is easy and systematic. So first of all, you have to listen to your candidate, your service user, about the medical history and the physical examination. Anything that might be suggestive, even suggestive of a sudden cardiac death has to be considered. And after that, the immediate next step is to do like a resting ECG. In some cases, we might be in need to do stress ECG, and I will get through that. And the last stage is to do cardiac imaging for some of these assets. It's not like a typical screening method that we have to do for all of them. In detail, you have to hear either the patient have any family history for that, because the family history is really suggested that the patient might be at a good risk of having any cardiac illness, chest pain, congenital restriction, and this is again very suggestive. Resting ECG, this is mostly used for the exclusion of any advanced cardiac illness. So let's say if the patient have like an infarction or something like that, it's really clear to be identified by the resting ECG. We can also see from the resting ECG something like the congenital prolonged QT segment. This is again suggestive that the patient might have like a sudden cardiac death. So this, if we find such evidence, that has to be treated with caution. And for sure, it's not all the time like a positive finding. It's sometimes like a false positive or negative finding. So again, among the screening, you can find in the echo or Doppler that the patient may have like left coronary predominance, and this is again very suggestive of if the patient have any problem with maybe overloading or something like that, that might lead to sudden cardiac death. And for the veterans, especially the people above 45, we have to exclude the peripheral arterial disease because it's really common, especially in the white population. So it's really common, as I mentioned, in the middle-aged athletes. Exercise ECG is typically used for the elite athletes, those the people who don't have any problem. However, the history might be suggestive of having any cardiac illness. So exercise ECG might help in that. And the Holter one, if the patient is maybe mentioning something about the palpitation and the resting ECG does not show anything. And the advanced imaging is part, again, to be used in some cases, only some cases. So can you imagine how long this might take, or how much does it cost? I would say that this is definitely between 15 to 20 minutes. It's not more than that. It's minimal amount of money, but to lose one of your athletes or a human being is really a very devastating event. So what's the impact of that? Prevention, or sure, decrease of the incidence of the sudden cardiac death and better research outcomes. So ESC have made like definite screening methods, guidelines, I mean. So for the children and young adults between 12 and 18 years, this screening has to be done every 2 years. If they are going to play something like any competitive sports, as I mentioned before, the basketball, soccer, something like that, the veterans and masters athletes has to do a full risk assessment. So it has to be a full risk assessment. That's what I mentioned when I was talking about the cardiac MRI. That's something specific. We do that only for the veterans. It's not something usual we have to do for all of the athletes. And if we are talking about the elite athletes, the point that they are elite athletes itself is very suggestive of many of the cardiac arrhythmias, because we know that there is some evidence to suggest that certain cardiac arrhythmias are common in elite athletes, especially atrial fibrillation. So here, the exercise ECG or the Holter may be useful. So that was brought for us by the European Society of Cardiology in 2018 conference. So the digestive protocol, as you see, that we have all to work together as an MDT for that. This is not an individual work. But however, we have like a definite strategy for that. The utilization of the cardiac rehab services all over the world is still very low compared with the evidence-based treatment. And earlier studies suggested that it's in average about, I would say, 30%. In UK, if you see here, it was like 59%, and it's not that good. We have to use this strategy and globalize it all over the world. This is really, really important. So the message in brief that the cardiac rehab services are really helpful in improving exercise tolerance in even well-trained patients if they have like a suggestive history of cardiac or vascular disease. Screening for them is really essential and worthy. VO2 max is like a part of this process, but it's not that important because many of us is like thinking that this is really the most important part. And cooperation of the multidisciplinary team in providing the cardiac rehab service is really, really mandatory. And thank you very much.
Thank you so much, Hady. It was a great session and we enjoyed it a lot.
Thank you very much.
Any questions from the audience? With no questions, I think they've understood it pretty well. Thank you so much for being with us today. And I know there was a lot of complications that went through the day, but finally we could see you and we could hear you.
Yeah, thank you. Thank you very much.
Have a great day. Have a great day. Yeah.
See you.